Hello, my name is Dr. Adeosun Emmanuel, and I'm a doctor in the UK. In this video, I would like to talk about the Plab 1 exam. So the Plab 1 exam is one of the first entry exam you'll have to write to work as a doctor, especially if you're an international medical graduate. One of the exams you'll have to do to qualify to practice in the UK. From what I've read and from what I've heard, they are changing this exam to the UKMLA, which would kick off I think in 2024, and it's still close to what the Plab 1 entails. I think it still has similar syllabus to what it entails, so I don't think there'll be anything different. During my own exams, I wrote the Plab 1 and also the Plab 2 to qualify to practice in the UK. So I had to write the Plab 1 twice because it was that kind of exam. So we had 200 questions. I think we had 2 hours, 2 to 3 hours to write the tests. I did the one initially I did not pass. But that first one was quite a challenge for me because I couldn't finish at the right time I was supposed to finish. So I rushed, I think, my last few questions, which I knew that it would be a challenge. So when I went to write the second one, I made sure I prepared a lot with my time management and also had good basic knowledge of all the topics. So there's one thing to know the questions that are going to come or the likely questions that will come out, and there's another aspect of having a deep understanding of the basic topics that comes out from the exams. So what I would advise is for you to go to the GMC website and get their syllabus, especially the topics of where they pick their questions from, and have a very good knowledge of those topics before you start answering the questions. Then after that, you have to train yourself to make sure that you can answer questions in good time. So what I did is I wrote mocks that could help me to time myself and have good time management. So for when you're writing a Plab 1, it's very essential that you take one question and at least you spend like less than 30 seconds to answer a question. That would make you finish the exam in good time and even have time to revise before you submit your answers. So it looks like a very cumbersome thing, but it's doable. If you've gone to med school, you've been practicing for a while, it's something that you can do. For Plab 2, it's more of a practical scenario that you're going to be put into. You're going to add your clinical knowledge, but also you're going to have this practical setting where you would have to show your competence as a doctor. You will also have to show your compassionate side as a doctor on how you relate to patients. This also assesses your history taking, your examination, and how you would manage a patient in a normal clinical setting. So the Plab 2, it's more like an OSCE setting where you're going to see patients and you're going to be drilled to manage those patients. For the Plab 2, I think the basic thing you need to know is to have a basic knowledge of the topics that are being run in this place, and it's easy for you when you're able to know these topics that you are supposed to take in this Plab 2. You practice with these topics, and we also have the Seaman station where you get to manage an acutely unwell mannequin, like a sick patient, where you would see a sick mannequin and you would need to treat the mannequin for the mannequin to get better. So there are a lot of scenarios like that. We have the scenario of the pregnant woman, the one with the anaphylactic reactions, stuff like that you just have to learn. So for those scenarios, you go through the normal ABCD technique for the Seaman scenarios, but for the other scenarios, you would have to know these scenarios and practice them. And another thing that cuts across both Plab 1 and Plab 2 is time management. So if you're able to manage your time and get the diagnosis, get the right management for these patients, you should be able to pass this.
What are the tips and materials that you used while you prepared for your Plab 1 and Plab 2 exams?
So for the tips for Plab 1 and Plab 2, I don't like to advertise for people, but the material that helped me a lot when I was studying for Plab 1 was Plabable. There is another tutorial group I joined. If you would like more info about that, I think you could ask in the comment section, and Dr. Noyo would answer that. I also had to learn from a tutorial group, which was very good for me. It really helped me because it made me to learn these basic topics effectively, especially when you're working. You're working and you're trying to study for these exams. It can be very cumbersome. But when you have people that tutor you for these topics, you try to find time, you watch the videos, and you are able to understand the basics of the exam. And for Plab 2, what really helped me was practice. And I also, the mocks I did from my tutorial group also helps me. So if you want to know about these tutorial groups I joined, I think you should just ask in the comment section and we could get back to you about that.
Can you tell us about the pathways to get a job in the UK as a doctor?
So passing the Plab 1 and Plab 2 is just the first process of going into the UK. So you would get your license to practice in the UK, and this license enables you to be able to find a job. And there are two pathways for getting a job in the UK. We have the training and the non-training pathway. For the training pathway, you have to go through the Oriel website where you need to apply for a specialty program, and they will invite you to write exams for the specific specialty you want to join. And if you meet the cutoff mark, you get invited to start training in that program. Each program have their specific requirements that you would need to read on the Oriel website, or even you just need to go to the website of each specialty you want to join to just get more information of the requirements for each specialty. It can be quite challenging, especially if you have not worked in the UK before, to start from a training job, but it's doable. I've seen a lot of people come from different parts of the world coming to start a training job from their first UK job, so it's doable. The other part is the non-training pathway, which sometimes for the past few months now has been quite difficult because of the amount of IMGs trying to come into the UK. So for the non-training pathway, we have websites like the NHS job, the track jobs, where you could look for non-training posts and apply for them. Each post has different specialties that look for non-training doctors to fill this post. So it's a post that you could use, a place where you could just go to this website and apply.
Can you let us know tips for applying for non-training jobs?
So tips for applying for the non-training jobs: you just have to make sure you get a good cover letter, which is a total content on its own. To write the perfect cover letter, you could speak with people that are already in the UK and get tips from them. Also, building up your CV. Your CV is very important when you're trying to get a non-training job, and make sure that you apply as much as you can, because you will get a lot of unfortunately, but keep on applying, don't give up. And that's the tip I have for that.
What are the tips to passing the interviews to get a job?
So for the interview stage is you would need to prepare for those interviews, because they are different from the kind of interviews you've been doing in your country or wherever you're coming from. So you need to learn. There are tips online. There are a lot of websites, YouTube channels where you could get tips on how to pass an interview in the UK, especially when you are trying to get into the UK as a doctor. There are a lot of resources out there which I used, which helps me prepare for the interview. So for the interview, one of the tips I'll give you is to be confident, know how to present yourself, sell yourself, and don't be too scared to tell them that this is what you can bring to the table and this is what you want to learn. You're passionate about the specialty, just speak about yourself. And for the clinical scenarios, just be confident. Even if you think you did not get it, just be confident and answer the questions, and I wish you all the best.
Can you give us tips on how to settle in the UK?
Okay, so for settling in the UK, I think the first thing I would advise is that you take things easy, especially when it comes to your job. Learn from others, from people what the training and practicing in the UK entails. So there's a lot of differences from back home where you come from. You would need to listen to people, listen to your medical colleagues and elders, and let them show you the path. It's going to get overwhelming. The first few months are always the toughest because you have a lot to learn. It is very doable if you just relax and learn. So the first key is to learn. plan. In terms of the weather, in terms of the cost of living, I think you should just take things as slowly as possible. Don't compare yourself to people that have been here for 2 years, 3 years, 5 years. Just make sure you take your time, get the things you need at the particular time. Don't get the things you want, get the things you need at a particular time. That okay, if you need a jacket for winter, get a good jacket. Get things that would get you to go around town, things that will make you feel comfortable. When you start getting to know your area, then you can start to plan properly. So what I will advise you is to get your essential stuffs. Speak to people around. There are always people ready to help, and that's one thing I've learned about this place. When you ask questions, you get help.
What are the benefits of working in the UK?
There's a lot of benefits. I can't even start counting, especially for someone like me that came with my family. I think we have there's a good quality of life in the UK, a better quality of life, standard living, where we are more comfortable. We are able to live life and plan ahead for the future. It gives you that kind of security. And when it comes to my career, I think looking forward into new possibilities of my career, and it's given me new channels where I can just open up my mind and dream ahead and say that yes, I can achieve this. And this is one thing I really wanted to do when I came into medicine, and the UK is opening my eyes to see new opportunities. And in terms of I'm improving. I'm learning things more. I'm learning a lot of new things in the UK, which is very, very important as you work and as you grow as a person. I just don't go to work thinking I'm just going to work. It's going to be another same old day. But I keep on learning new things, which is very important as a human being. And one of the good things I've gotten from the UK.
What would you have done differently if you went back to medical school?
Okay, so if I'll go back to medical school, one of the things I would want to do more is to make sure I go to more conferences, medical conferences. Utilize the fact that as a medical student, you are always given some priority when it comes to going for conferences. I would have gone for more conferences. I'll probably have written more professional exams before I graduated, because it would have made life more easier. Because I've noticed that most of these exams, it's quite easier for you to write them when you're still in med school, because those things are fresh and you have more time to do those things, because when you start working, it's more difficult to write those exams. So I would have written more exams, professional exams. I should if I'm going back to med school, I think I would have taken another course in maybe something different. Maybe I would have gone to do some IT courses. This would have helped me more if I was still in med school.
What are your final conclusions for doctors?
So if you have decided that you want to come to the UK to practice medicine, I would say it's a good decision, because it's a very good place to practice. They have standard healthcare, which is good, and you are able to learn and become a better doctor. You can be whatever you want to be. You can dream and aspire to be at the top level. Just if you are hardworking and you just put your mind straight, you will achieve whatever you want to achieve. So it's a good learning place, and it's a good place for you to dream and achieve all you. So in the coming years, for me, I'm just hoping to make sure that I make my family comfortable, and I'm able to be comfortable in whatever path I choose. So it's not just about working. It's not just about following a career path. It's about you being comfortable and loving what you do. And hopefully in the next few years, I'm hoping that the choices I make now would put me in that path. So my final words to everyone watching this video is for you to be intentional about everything you do. Make sure you plan ahead, have a to-do list, have long and short-term goals, what you want to achieve. Don't just take up the whole world and say you are going to do this. Take your small wins and celebrate it, and dream ahead. When you dream ahead for the bigger things, look forward to what are the small goals that would make you achieve those bigger goals that you have. And if you can do that, you'll see yourself at the top.
Thank you for watching. More interviews coming your way on my channel. Do like, share, subscribe. Until my next video, God bless you. Bye.